Good morning, and thank you to our witnesses for your testimony and for being here today. The National Animal Health Laboratory Network plays a key role in protecting food supply chains, identifying disease trends, and limiting the spread of infectious disease among animals. The network also plays a key role in educating producers and the public about potential disease outbreaks. The Connecticut Veterinary Medical Diagnostic Laboratory at UConn is the only network laboratory in New England serving producers in Connecticut and across the region. Each year, the lab at UConn, I didn't mention I'm from Connecticut, trains approximately 40 graduate and undergraduate students and provides them with hands-on learning opportunities. The lab has identified this as an area for growth where it can develop better programming for students to gain real-life experiences. Dr. Jones, UC Davis offers numerous outreach opportunities for pre-veterinary students, including summer programs for middle school and high school students to learn about the field. I'm an educator by trade, and I'm always thinking about pipeline, capacity building, the future, how we engage young people much earlier and introduce them to the potential of so many careers that are within their grasp. Can you describe how your laboratory partners with UC Davis to train veterinary students?
Sure. The Animal Health Lab at Davis not only has a lab located at Davis, but they also have lab sites at different locations throughout the state. So they're able to partner with not only the students there at Davis, but also bring them a little bit further down into our Central Valley, which is really the heart of agriculture in California, to give them a little bit more of a taste of the real world of producing food for large groups of people. So that's one of the examples of how they interact with the vet school and with the undergraduates in high schools.
Can you talk a little bit about how you utilize the National Animal Health Network Laboratory Network to perform outreach to students and just, I guess, expose them? Because what I've heard, many young people have an idea of what they think careers and professions are, but it's not until they have some actual practical interaction that they really kind of see themselves doing that work.
A lot of that type of role, if you're talking about the laboratory network itself,
or any network that you use.
Yeah, a lot of that exposure comes through summer hires and tours, and it gives students a real flavor for the science technology involved in today's animal health world and food safety world.
Dr. Mame, I see you nodding your head. Did you want to add something?
Yes. So in Iowa, it's very much I think it's over half of the students at Iowa State College of Vet Med graduating go into either mixed or large animal practice. And the vast majority of those students are not farm kids. They're students that are bright, and they through work experiences at school, internships, whether in undergraduate and externships in veterinary school, got turned on to animal agriculture and have chosen to make a profession of it.
Thank you, and I appreciate you adding that, because many of my farmers are telling me now, like, their children don't want to go into ag-related fields, so we have to be more attractive to a broader network of young people in order to infuse this pipeline. In 2023, a study by Johns Hopkins University found that the number of food animal veterinarians has decreased by 90% since World War II. Today, less than 2% of veterinarians work exclusively with food animals. Outside the lab, veterinarians are the first line of defense during a disease outbreak, meeting first with impacted farmers and then reporting their findings to network labs. Dr. Redelick, in the materials you provided to our committee, you mentioned that the Kansas State Veterinary Diagnostic Laboratory experienced a 62% faculty turnover in 2022. Has your lab worked to address these shortages, and what could Congress do to help with that effort?
I do think that all the labs saw shortages in 2022. For us, it was getting in more technicians. We developed a technician internship pipeline or a program, and so we started bringing in those younger generations for technicians. We were able to increase our residents. Our residents are those training to be faculty, and so we were able to increase our pathology residents. And so, again, we're thankful for the support we get through the NOLN. That does help support salaries, and so that investment is going back to helping train those technicians with salary support, providing the internships, and helping us train future faculty through residencies and graduate programs, which is important in keeping our staffed.
Thank you. And with that, I yield back.